am Dr. Manju, Group CEO of Meditrina Hospitals, Kollam. In Kerala, actually we have achieved most of the targets, the global standards or targets for healthcare, and even we are far achieved more than that. That is the infant mortality rate, maternal mortality rate, all are far less than what we have to achieve. So, talking about the other diseases like the non-communicable diseases like diabetes, stroke, cardiovascular diseases are much more in Kerala. So, now we have to concentrate more on the non-communicable diseases comparing with the other states in Kerala, where in many states in the northern districts you have you have not achieved the immunization. It is less than 10% in some of the districts or some of the areas, whereas here we have achieved 100% target. Our infant mortality rate is far less than the US standards. That is a health scenario in Kerala. Meditrina Hospital started with a cardiology setup in a model called as SIH, that is specialty in a hospital. So we were providing cardiology services in a parent hospital where they have all other facilities, where all other departments. So the advantage of this SIH model was it was having less financial burden, like you have to spend only on the equipment and the manpower. So it was a successful model, but the only thing that was, to start with, it was a good model because you have to spend less money. But the disadvantage of this model after this 7 years, we have seen that after a long, it's not a good business model for a long run. You have to face lot of problems when you are a successful person in successful department in that hospital. You have to face lot of problems. That is why we have next switched on to the another model called as independent system, independent hospital. So we have started a hospital in Trivandrum, a Meditrina hospital, and in a major city. Earlier we were planning to start or provide health facilities to tier 2 cities, because major metros and major cities will have all the facilities. So we were planning to give more facilities for the tier 2 cities where health requirements, treatment facilities are needed. So now then we have moved to the Trivandrum, where we started the independent hospital. In that hospital we have faced a problem, like when you have a cardiology service, there will be associated diseases like diabetes, hypertension, and some of the other problems like associated renal problems will be there. When you have cardiac diseases, when you have diabetes, hypertension, all renal problems will be associated. So the well-off people or the higher socio-economic status people will look for a hospital where you can get all these facilities, a comprehensive place they will look for. So we face this problem. So in our hometown, in Kollam, we thought of starting a fully fledged multi-speciality, super speciality hospital. And then we started the Kollam unit 3 years back, and it was very successful. Then we thought of starting hospitals outside Kerala. And our chairman and managing director, Dr. Pradap Kumar, has an idea of providing cardiology services to the needy, that is in the ESIC corporation, where they don't have any super specialist in the entire ESIC hospital in Kerala. So he had started providing cardiology service in the ESIC hospital in Kollam. So this model, he was discussing this with the then superint, and that was a PPP model of cardiology setup started in the ESIC hospital. That was actually the brainchild of Dr. Pradap, and we have started the first cardiac PPP model in ESIC hospital, and it was really a successful model because the government is giving space. You have to provide equipment and manpower and 24/7 services, and we were providing in all our centers, we were providing quality healthcare. We were providing high-end equipments and all related associated facilities and equipments for the complete healthcare of the patient. Cardiology, as far as cardiology is concerned, the advantage of Meditrina or our USP is actually we are doing complex coronary intervention. That is not done in most of the hospitals. I can tell you, if we are actually one of the, Dr. Pratap is one of the top 5 interventional cardiologists who can provide complex coronary intervention. So the advantage is that we are giving this health facilities at 50% of the cost of the CGHS rate. So complex coronary intervention will be done in many of the major hospitals at 10 times the cost we are providing. So the advantage is that the poor section or the low socioeconomic status people is also getting the same facility or the same treatment which they cannot afford even the government cannot provide. So that is the advantage of association of Meditrina with the government. And one of the other successful model is that the same PPP model we have gone internationally, and maybe because of our service, even from the president we have got the invitation to start the PPP model in Republic of Maldives in Indira Gandhi Memorial Hospital, only one government hospital in the Malay Island. So that we have started, nearly 1 year we are going to complete, and our success rate is 98%, and we are doing complex coronary interventions also there. That is the only one cath lab which is there in the country, and all the people who are having heart attack were coming from the island or from the other smaller islands to India or Sri Lanka or abroad. So now they are getting primary angioplasty or heart attack angioplasty or primary coronary intervention for heart attack in the country itself. We are providing 24/7 service in all our cardiology centers. So after this we have started one in Jamshedpur. That is also a standalone hospital, but the advantage of Jamshedpur hospital is that compared to the Trivandrum hospital, in Trivandrum it was a major city, whereas in Jamshedpur, even though it was only cardiology, it is a very successful model, and it is running very successfully because there are no good cardiac facilities in Jharkhand, and also we are providing the treatment for the complex coronary intervention. So our major success is that we are providing services to, we are not rejecting any case, we are providing services to all types of diseases, all types of coronary intervention we are giving treatment. That is our success rate. Now we are planning to open a unit in Bokaro, which is another model, that is a JV model. The advantage of JV model is that we can have a local partner there. You have the land and building, you need to invest only on the equipments and the manpower, and the advantage of the local partner is that you have the ready-made patients there because of the local contacts there. And the advantage of like the PPP model also, the government setup, you have the you don't have to do much of marketing activities, you have the ready-made patients. We have opened smaller units in Kottarakara as well as in Palakkad. In Palakkad also we have a partly JV partnership model only. So the local hospital or the local partner will also take care of some of the marketing activities. So Bokaro also we are planning a multi-speciality hospital because that area also is not having much of the health facilities. So now we are planning more to move to the eastern side or the northern side. So we are planning to start units in Bihar, Orissa, Chhattisgarh, UP, and also now we have signed the agreement with Haryana government. So we are starting 4 PPP model in Haryana, Ambala, Panchkula, Faridabad and Gurgaon. And here also we are providing the excellent facilities, the top class facilities with all of international standards, with all high class equipments and all other facilities which are not there in even the major hospitals like IVS, OCT, rotablator. Such facilities are also we are planning to provide in this government setup, and also at 50% of the cost of the CGHS rate. So in all these such models, the disadvantage is that the margin is very low, the profit is very low. So only if you have high volumes you can have the success. And now also we are planning to move internationally outside India, like countries like Nepal, Oman, African countries also we are planning. So in areas where the healthcare facilities are not there, or where the healthcare facilities are less,